Do you want to face the NCLEX with confidence but don't know how to achieve this goal? Stay with me and I will explain. This exam is not about memorizing everything, but about demonstrating critical thinking and clinical safety in your performance as a nurse. The NCLEX goes beyond memorization, as it evaluates whether you can apply it through knowledge. It doesn't want definitions. It wants to know if you can act correctly in a real clinical situation. This is why you must focus on applying, analyzing, and evaluating. For example, it's not enough to know what digoxin is. You must identify toxicity and decide on the correct action. The exam adapts to you. If you answer correctly, it will give you more and more complex questions. If you fail, the level will decrease. Don't worry about the number of questions. Focus on each one as if it were the only one. So then, what are the clinical prioritization strategies and why are they so important? Order really matters. Always think, is the patient breathing? Is the heart beating? Is there an immediate risk? Pain is important, but life is more important. That's why on the NCLEX, you must apply the following strategies when prioritizing and answering. First, Maslow pyramid, a psychological theory that proposes that human needs are organized in hierarchy and must be addressed sequentially. Physiological, safety, social, and finally self-esteem. Second, ABC prioritization, airway, breathing, circulation. Follow this order when prioritizing patient stability. And finally, we have the patient safety. Immediate life risks always take priority over patient comfort. For example, a patient with pain 8 under 10 versus patient with respiratory distress, always the airway must be prioritized.
Now, let's talk about keywords you should identify or avoid in questions. Identify. First, misprioritization is being tested. Safest. Several options may be correct, but you must weigh risk versus benefit. And finally, require immediate intervention. This signal is urgent life-threatening situation. Now, let's talk about avoid. Absolute options like always or never. Distractors with irrelevant information. And finally, when reading questions, mentally highlight the keywords. Often the clue is right there. Be wary of answers that show extreme or contain a misleading element. Don't get frustrated with difficult questions. They are part of the exam. If two options seem correct, the safer one is usually the right choice. Think as if the patient were standing in front of you. If you are torn between two options, keep in mind these strategies. First, choose the one that promotes safety. Second, access before intervening, except in life threatening emergencies. And third, ask yourself, what will a competent nurse do in real practice? A miscalculated dose is just not an exam mistake. It's a life-threatening risk. That's why in pharmacology, the most important thing is understanding the drug class and its action, along with constant practice in dosage. Here are four key points to keep in mind when studying pharmacology. Memorize drug classes, not brand names. Link severe adverse effects with immediate actions. And review common interactions, for example, anticoagulants versus antibiotics. And finally, practice dose and IV drip calculations daily. To prepare effectively for the NCLEX, you must also consider self-care. A tired brain performs poorly. Practice relaxation techniques and study in short effective blocks. Stress can affect you more than a lack of study. Here are some practical techniques. Slow breathing before you begin. Active breaks before 15 minutes. Stretch your body and distract your mind with a short activity. Full exam simulations under real conditions. Practicing with mock exams is the best way to train your mind. It's not about memorizing answers. It's about understanding how to think and improving your reasoning. Use official question banks, NCLEX-RN and PN. Take full-time mock exams. Don't just review mistakes, analyze your critical reasoning. Study patterns. Do you fail more in pharmacology, pediatrics, or prioritization? And finally, remember the NCLEX is not an enemy. It's your getaway to practicing your vocation. Always think in terms of safety and prioritization. Practice with purpose, not just in volume. Trust your training. You're already the nurse. You just need to prove it. Reaching the ankles means you are ready. This exam simply confirms that you can practice safety. And if you are ever feeling sure, let's Enfermeras en USA with the right staff and resources help you achieve your goal.